In this video, I'm going to talk about the number one exercise I wish patients did not do for their back pain. And if you're doing this, you can understand why you might have been recommended it before, why it's probably not helping you, and what you should be doing instead. So first and foremost, most lower back pain is caused by compression. If you've watched any of our other videos, you'll know, we go into lots of detail on this. But the big exercise that I really don't like is this knee hugs, where patients are bringing their knee up to their chest and aggressively pulling that right in there to stretch the lower back. And I'll explain right now why this is given, first and foremost. Now, a lot of cases of back pain, down here there's some inflammation. You've injured invariably the segment, but maybe there's some disc involvement as well. And by aggressively pulling yourself in this direction, what you're able to do is take this little bony canal down here where the nerves come out, that can cause things like sciatica or local back pain, and you make that hole bigger. The reason you get pain is because inflammation builds up in this area and starts to press on the nerves, or a direct disc bulge presses on the nerves and it doesn't have any place to go. And by making that hole larger, you alleviate temporarily some of the pressure on the nerve. The problem with this is that it's very, very short term. What you're essentially doing is forcibly driving pressure through the front of the vertebra in an effort to open out the back space. And what that does is drives pressure on that disc, which may or may not be injured, forcing the center of the disc, the nucleus pulposus, to drive backwards into the annulus, which is the ligament structure that actually encloses that fluid space. And if there's any minor tears or strains, which invariably there are with these sorts of lower back problems, there's some element of disc involvement. It doesn't have to be a profuse herniation. It's going to cause more aggravation and more irritation of that disc that's trying to recover, as well as irritating further some of these ligamentous structures that aren't designed to move that far. The ligaments on the back here are designed to hold a nice smooth curve here, and by you forcing them in that position when they're already injured, torn or damaged, you're actually creating more inflammation as a result afterwards. So if you could do one thing after this video, it would be stop doing that exercise and start working more on your posture, keeping upright, trying to keep that natural curve, using a bit of ice on your lower back, a couple times a day, 5 minutes, 3, 4, 5 times, straight in this lower back area. Even if, as is commonly the case, the pain is a little bit lower or in the glutes or down the leg, focus on this region here and try and keep it upright so it's nice and balanced, so you're not putting excess pressure on those injured structures. What you'll find is with that understanding, you'll be able to start avoiding specific things that are making you worse. Now, with a lot of cases, it's these wrong exercises that are making patients worse or not getting them better. And we've put together our Back in Shape app, which you can find out more about in the link somewhere down here, which has specific exercises that you should go through. If you've got any more questions, do be sure to comment in the description somewhere down here, and our team will do our best to give you as much guidance as we can from here. And remember, if you want more help from the comfort of your own home, click the link and find out more about our Back in Shape Home Edition program. Thanks for watching.